Welcome back to the Educational Diagnostician series. Today we're going to focus on the different types of observations as part of educational evaluations. And there are three different types of observations. So we want to really look at who can actually complete them, because there are certain situations where it has to be a certain person or it can't be another person. The different types of observations and knowing how to distinguish between those. And then we're going to dig heavily into the different ways that you can do systematic observations, which tends to be the most difficult for people. Finally, we'll focus on the write-up and give you some resources for that as well. So who can complete the observations? Really anyone can, as long as you've got some training on how to complete them correctly and write them up, then just about anybody can complete observations. There are a couple of situations where it needs to be identified as a specific person. So for students that were looking at a speech impairment, the type of evaluation required, the observation has to be completed by the speech language pathologist. When we're looking at a language impairment or specific learning disability, it needs to be completed by someone other than the classroom teacher, because the observation should occur during typical classroom instruction. So we want to make sure that the teacher is teaching just as they normally would, and that we can gather additional information. And it's really hard to complete an observation of a student while you're teaching. So the law clearly says that it needs to be somebody other than the classroom teacher. So we have three different types of observations that are spelled out in Article 7. So the first is for speech impairment, and it says that we need to have at least one observation of the student's speech completed by the SLP. So very cut and dry. The SLPs know what to look for when they're going into to listen to the student's speech and be able to hear those disfluencies, be able to hear those articulation errors, be able to identify whether or not it's interfering with other people's understanding. And the speech language pathologist has very specific training in this. So that's the big reason why the law says it has to be the SLP. Language impairment's a little different, and language impairment and specific learning disability require the same kind of observation, and that is an observation in the student's learning environment. So we're in there to be able to document the student's academic performance in the area that we think there's difficulty. So it's important to know what that difficulty is and go in and observe it in that setting. That can be done by anybody except for the classroom teacher. Finally, a systematic observation is an observation required across environments. So at least two different settings or environments, and this type of observation is required for multiple areas: for autism spectrum disorder, blind or low vision, deafblind, developmentally delayed, multiple disabilities, and other health impairments. So those are a lot of different areas that have that requirement for systematic observation. And we're going to go into several of these in a lot more depth. So the observation required for language impaired or specific learning disability evaluations, we can use observation information that came prior to the evaluation beginning. Now, a lot of times we may not have this information, or we may not have felt comfortable completing an observation without gaining permission from the parent. And so a lot of times this doesn't happen unless it's just to gather data in order to say, yes, I think we need to move forward and initiate this evaluation. So it can be completed before, or it can be completed by a member of the multidisciplinary team as part of the evaluation process. It needs to be someone other than the general education teacher, but it's also important that we consider differences for students who are preschool age. So we don't maybe have the academic environment or learning environment that we would for kids who are attending school. So we just need to make sure and observe the student. If we're looking at language impairment, usually it's not SLD at that point, but a language impairment, we need to observe them in a setting that would be an appropriate setting for that age. So it may be during playtime, it may be at their daycare center, it may be in the home. There could be a lot of different ways that we collect this data. So some tips in completing this kind of observation: make sure that you have enough data ahead of time to know where you should be observing, in what class you should be observing. If your permission form only identifies that we're looking for a specific learning disability, but doesn't tell us that we're concerned mainly about reading, then going into math class is really not going to give us the data that we're looking for. So make sure that we know specifically where we need to go, what classes we might need to go and observe in. As you're completing this observation, you're going in to look for things, right? You don't necessarily go in to look for a specific behavior, but you're going in to see how the student is doing in class. I usually make notes about the environment of the classroom. How many students are in this class? Are the desks in rows? Are they in pods? Is there an additional adult in this class, or just the classroom teacher? Could it be a co-taught class? There are a lot of different environmental things that can be important in knowing what's going on with the student. Sometimes classes are more chaotic than others, and I usually make note of things like that too. If there are a lot of other students who maybe are drawing a lot of attention from the teacher, or acting out that might be disruptive to the student's learning, that's important to note. Look at how the student responds to the content. So if the student is asked to pull out material and start to read, do you see any reaction? Do you see any negativity? Do you see the student trying to avoid eye contact with the teacher because they don't want to have to be called on or something like that? Look at those other behaviors. Does the student raise their hand? Does the student offer to answer a question? Do they ask for help? Do they follow directions? How do they respond in a group setting? How do they respond when they have to work individually? There are a lot of different things that you can take notice of. But generally, a write-up for an LI or SLD observation in the classroom tends to be a paragraph or two that just is explaining what you saw and what kinds of things might be important for us to know. Systematic observations are quite different, and I've seen a lot of evaluations that should have contained a systematic observation but really didn't. So there are some things that make it very different from our other kinds of observations. So we're going to start with Article 7. So Article 7 specifically in the definitions section defines a systematic observation as an observation conducted to measure very specific, well-defined behaviors using structured recording processes. So there's some very key words in here that are important. So first, they need to be specific behaviors that are well-defined. That's a big piece, which means I'm not going in and writing up what I see. I'm determining what I might see and what I think I'm going to see, and then I go in and observe for those specific things, which means it's important for me to understand what those things might be and define them before the evaluation begins, not during or after. And then the other piece that's really important is that we're using that structured recording procedure. There are many different kinds of structured procedures that you can use, but it has to be something that is identified. And again, you're going to identify this prior to the observation beginning, and you're going to use that process to collect your data. So our purpose when we go in is to look at the student across environments. We want to make sure that that we're getting some consistency, right? We want to make sure that the behavior is not only happening in one particular setting, because then it may be something else that's contributing to a particular behavior. So we're going to look for behaviors that are commonly associated either with the disability or condition that's suspected. So remember, a systematic observation is used for multiple things: other health impaired, blind, low vision, autism spectrum disorder. We've got a lot of different things that this can cover. So again, I have to go in knowing what is the disability area, and then even more specifically, what are we already seeing in this student that I should go in and record so that I can make sense of, is it unusually high? Is it unusually intense? Is it happening more often than it does with other kids? Does this stand out? As I do a systematic observation, I'm usually having a comparison student as well in order to make sense of the data. It's important to know that if I say a student is on task 50% of the time, is that good or bad? I don't really know until I have a comparison. If the other students in the class are typically on task about 50 to 60% of the time, then that really doesn't seem like such a big deal. But if other students are typically on task 80% of the time, that's a pretty big gap in the behavior for this student in comparison with others. So we're also going to look for behaviors occurring across context. So content areas may be important. It may be social situations versus structured situations. It may be differences in personalities or classroom management styles of the teacher that could contribute to that as well. If it is something associated with a disability, you may see it less in one setting, but it won't disappear. And I think that's important for us to understand that, you know, if I'm acting up in one setting and it's because of a disability, then we can help mitigate that. I can go to a classroom where the teacher has, you know, wonderful supports, but it's not going to go away altogether. Because it is part of a disability. And that's one of the things that we're looking for in this process of doing multiple observations. So again, some of those characteristics that make a systematic observation different, it does need to measure those specific behaviors. So sit down with your teachers, sit down with parents, or have that phone conversation or that email exchange to say, okay, tell me what this looks like. Tell me what you see and what I should be looking for when I go in. So if it is something like, if it's something like ADHD for a specific or for other health impairment, then you may be going in looking for some of those characteristics of ADHD that has been reported for this student. So off-task behavior, getting out of a seat, calling out without raising hand, you know, those kinds of things, lots of movement and fidgeting. But if I'm looking for behaviors associated with leukemia, then it may be something like falling asleep, putting head down, giving up on something because I can't focus. Ask what the concerns are. Some of our students with blind or low vision, you may be looking for things that are extremely different than you would in a systematic observation for a student in another area. So talk to the people who know this student well, because you may not. You may really just be coming into this without a lot of exposure to the student. Know what those behaviors are and come up with some specific definitions. I want to be able to observe a student, gather data, and report on it, and know that if one of my other team members went in to observe the same thing, I can be specific enough that they are looking for the exact same behaviors. So some of our behaviors tend to be a little bit fluffier without a lot of good hard definition to them. And if I say aggressive behavior, what exactly does that mean? Tell me what it's going to look like so that I can be specific about the aggressive behavior. So for some people, aggressive behavior is just getting loud, and for others, it's hitting. And I need to know ahead of time what I should be looking for, because sometimes you miss them. This often comes up too with our students who maybe have seizures, and we might be looking for other health impairment for a seizure disorder. And seizures look very different in very different kids. So if I ask the parent in advance, what does your child's seizure look like? What should I be looking for? Because sometimes kids have like tells that that we may not pick up on unless we already knew what to look for. Think about some of those symptoms of different disabilities or different diagnoses that are out there that might be important to look for as well. So again, we know what the symptoms are for ADHD, and now we need to consult with the parent and teacher about which ones do you see, so that I can go in and start recording those. But you may have things like, if you're looking for a student with autism, we know that some of the symptoms are some of those stereotypic motor movements. If I know that that is going on with a student, I'm going to ask in advance, what kind of stereotypic motor movements should I be looking for? Because they're different from child to child. And I may not recognize the same ones that the teacher or the parents see. We have to use standardized procedures that are objective. So we're going to identify some of those different methods here in a minute. We want to carefully select when and where we're going to observe. There are some students that we want to very purposefully watch in specific classes. Others that we want to make sure that we look at those unstructured settings as well. So a lot of times if I'm observing as part of an autism evaluation, I'm going to want to look at both a classroom setting and also a setting that is a little more social, whether it could be at recess, it could be at lunch, to see what kind of social interaction, what that looks like in that setting. Maybe sometimes going into a setting where things tend to be louder or quieter can provide some more information. We have to score and summarize our data consistently, so we have to have a way of collecting that data and how we're going to interpret it. And it absolutely has to be across environments. So environments can be different settings, different classes, different teachers. It also can be, in some of our situations, large group, small group, because some of our kids are in the same room throughout the day. So think about how we can look at things in different ways and utilize that across environments to the best that we can for answering the questions we have about the student. So asking, when do you most see the behaviors? When do you least see the behaviors? Sometimes that can be a really good thing to observe a student in a setting where we almost never see a particular behavior come out. Number one, because it tells us more about whether this is a consistent kind of thing for the student, but more often what we get to see is a variety of tools that might be used to help mitigate that behavior, to help encourage the positive behaviors, and reduce the things that we would like to to see decreased. It may be a style of teaching. It may be visual supports. It may be more structured classroom management procedures. It may be that the room is dimmer or quieter. There could be a lot of things that contribute to that, and that's another thing that we want to make sure and look for. So again, at least 2 observations, and make sure that when we write them up separately so that it is very clear in your report. I've looked 2 different times, 2 different places, 2 different settings, whatever it is. So when we start collecting data, we want to think about the method to use for collecting that data. We can use a variety of procedures, and some behaviors lend themselves better to certain procedures than others. So one thing that we can use is a frequency count or an event recording. So the number of times that something happens during an observation. In this case, you want to make sure that you are explaining how long you were there to observe, because the time period, a frequency count, if I tell you something happened 4 times, if I was there all day, then that's very different than 4 times in a 20-minute period. So talk about the length of the observation period, and then you can usually just make check marks, tick marks, whatever you want to make to count how many times something happens. This is a useful process when things that you're looking for have a very clear start and stop. We have other behaviors that aren't so clear. They kind of decrease a little and then maybe increase again, and they tend to kind of cluster together, and frequency is usually not as good for something like that, because you need to have very distinct instances of yes, it occurred again, yes, it occurred again. It's also important that you're looking for things that tend to last about the same amount of time each time that they happen. So if it's, calling out, standing up out of your seat, yelling at someone across the room, putting my head down on my desk, then I may have just a clear count of how many times something like that happens. You can also consider using duration recording, either by itself or in combination with a frequency count. And duration is just how long does something last. So this can be really good when you want to see either a positive or a negative kind of behavior and how long something happened. How long was the student engaged in studying? How long did a temper tantrum last? How long did an outburst last? Those are the kinds of things that you can see it start, and you start your timer, and then when it stops, you stop your timer, and you can record how long it lasted. You only really do this though when the length of time for something is important or makes a difference. So you can often combine frequency and duration to say, okay, the student had 4 different incidents, so that's your frequency part, of physical aggression, and you're going to want to be more specific on that, whether it's hitting things, knocking things over, whatever it is that you're looking for. And each of those instances lasted 60 seconds, 480 seconds, 93 seconds, and 112 seconds. That gives us even more information. You can also look at the intensity of something if you can clearly define intensity levels. So maybe we have very specific guidelines about what a mild behavior, a moderate behavior, and an intense behavior is, or a severe behavior. And if you can identify that, it's important to gather that information as well. Latency recording has to do with when does a trigger of some sort happen, and then when does the behavior start. So that's good for things for identifying. The teacher gives a direction, how long does it take for the student to follow that direction? Everyone get out your papers, and everyone gets out their papers, but the student you're watching takes 43 seconds before their paper is on their desk. Line up at the door. is this the last person in line to line up for the door? Responding to a question. We have some students, when we're looking at language processing, we may want to consider how quickly do they respond. A lot of our students that may have autism may take longer to respond to a question or something like that, or responding to a gesture. So that is latency recording. Now for me, the most common procedure that I use is using some time sampling interval recording. So taking the amount of time that I'm going to observe in a classroom and dividing it into specific intervals. So whether it's 15-second intervals, 30-second intervals, whatever you want to do. It's just it has to be very clear that those are my interval marks so that I'm consistent with that throughout. And then recording data. And there are 3 different methods that I want to focus on for collecting this kind of data. One is whole interval recording. So we are recording a behavior only when it occurred the whole time. So if I want to know if a student keeps their head up during instruction, if their head up was their head was up and they were watching or listening the entire time, then they get a mark for that interval. Or if a behavior occurred, a negative behavior, during the entire time. If a student was talking throughout an interval, or the student was out of their seat throughout an interval, then it would have to be the whole time for whole interval recording. Partial interval recording is similar, only you check this only if something occurred at any time during the interval. So it doesn't matter for how long or how much of that interval time period, it's yes or no if it occurred any time. You want to make sure and use this more for the behaviors you'd rather not see, because what you don't want to do is say, okay, I'm gonna observe 30-second intervals, and if at any time during that 30 seconds you're paying attention, I'm giving you a positive for paying attention. Because that really doesn't tell us a lot. If I was only on task for 1 minute or 1 second out of that 30-second interval, it really isn't telling me anything. It's probably more helpful to know if I was off task for any point of that interval time period. What I tend to use most commonly is momentary time sampling. So in momentary time sampling, again, we've divided our observation period into intervals. Most of the time I use 30-second intervals, and at the point that a new interval starts, so at only that very second that a new 30-second period starts, I record the behavior that's happening with the student. Doesn't matter what happens the rest of the time. The rest of my interval time is usually taking notes about the environment, the student's behaviors very specifically, and the interaction and things like that. But as far as the defined behaviors that I'm looking for, it's only at that 30-second mark. I also tend to use a peer comparison so that every 4th interval, and again, that's what I use, but it could be every other, however you want to do it. I'm recording the behavior, the same behaviors of a peer. So usually same-sex peer, so that you've got a more accurate comparison. I put an example on our Padlet of educational diagnostician resources that is just a systematic observation form that I tend to use. Some of you also may have observation apps that you are using on your tablets or on your phone to collect that kind of data, and they can collect a lot of different kinds of systematic or other observations, and those are really great. And I think a lot of our members out there are already using these things, and they're continuing to develop more resources like that, and we'll add some of those to the Padlet as we have them as well. But there are different ways that you can define these things. So on the form that you'll see, you define the behaviors. You talk about what kind of observation this is, what procedure you're using, when you're going to observe the peer. And it allows you to just complete this by counting up the number of times that you see something for a student and then dividing it by the total number of intervals that you observe the student in order to get those percentages. Some of the roadblocks that we see in doing systematic observations, and I think some of the reasons why I've seen so many evaluations where the observation really isn't compliant based on Article 7. One is our preschool students, because most of our preschool students are coming in to be evaluated for developmentally delayed. There is the requirement for a systematic observation across environments. And some of you are in a position to have a mock classroom or even a real classroom that the student can go in and you can do some observation there. Others, you're gathering information only in that sterile setting of a student coming into an office to be evaluated. And you may not have the opportunity to see them at a daycare, or this may be a student that doesn't go to any sort of preschool setting already, doesn't go to a daycare. It's really hard to get the information that you need. Another roadblock is our students who are in those self-contained settings where you may not see any differences in teachers. They may be with the same person all day. So we want to think about where else can we watch the student. So again, using the opportunities of things like sometimes cafeteria or going into gym or other kinds of settings at school like that. Interim alternative settings or homebound. Those can be situations where the student is not in a typical setting. So you're gathering the best data that you can, but you may not have opportunities to see the student in any place other than a single student in a single setting with no real classroom environment, and that can be difficult. Homeschooled students. Sometimes we get evaluation requests for students who are currently homeschooled as part of our Child Find efforts, and it's difficult to do an observation in that setting. It can be done, but it just is a very difficult situation. So I just encourage you to get as creative as you can. Try to figure out, are there ways that I can go in and observe the student in different places? You know, there are other opportunities out there. It could even be that mom says, you know, we're going to McDonald's this afternoon. You want to kind of be incognito and watch what goes on in that kind of a setting. Or you may have to look at preschool kids and watch them in the waiting room and watch how they interact with toys there, and then observe them during the testing setting. There can be a lot of creative ways to get to this, but I love the idea that a lot of schools have set up those situations where they can observe a kid in with other kids, even when it's not their usual group. But I think that's a great way to provide that information. So the important part is we're putting that good faith effort in. We're trying our best to gather the information. We're writing it up as best we can, so that we show that we're trying to get this done. We're trying to make sure that we meet all of the Article 7 requirements and still operate within the scope of reality. Now, right now, we've got a huge roadblock. We've got no opportunity really to observe students. As we move into the start of this next school year, which we really don't know when that's going to be, we'll need to think about how are we going to complete these things. My advice right now is we don't. Observing a student through a parent's computer camera or the parent's phone is not really giving us good information about how a student might interact in the classroom. There are a lot of home factors that are very different. So I think we've got to be very cautious about what we're doing now. However, as we roll into late summer, fall, winter, and we figure out what is this going to look like for us, we may have to come up with some additional supports for how can we really satisfy this requirement and continue to move forward with our Child Find efforts and make sure that any student that has a disability gets that proper evaluation and has all that covered. So stand by for future support in this, but just know that right now that opportunity is really not available to us. So finally, as we write up the last of this information, as we put together what should this look like in your report, I want to focus mostly on how to do the systematic observations. So you'll see some observation write-up examples in the Padlet, but it's important that it is very clear when someone reads this that you've done two different observations, that they are separate, whether you're separating them by activity, setting, classroom, day, time. They are two separate write-ups. Describe the environment that you observed the student or the setting. Describe the behavior specifically that you came in looking for. Explain why you were there. And include data. So you should either have frequency counts, percentages, that kind of information to make some very specific data available so that we can know how severe is this? How different is this from others? And we also include that peer comparison data in order to really make meaning out of the data that we gather for the student. Again, on task 50% of the time, could be good, could be bad, could be middle of the road, but I really won't know unless I have some comparison data from someone else. Thank you again for being part of this series. We hope you learned something from this and that you're continuing to join us for future topics and future work sessions so that we can grow together as a team of educational professionals, diagnosticians, school psychologists, occupational therapists, speech language pathologists, special educators. We are all working together to build this good team of evaluators that can give us great information about students.